educative, and interactive. So I would say stay glued to your TV set and let's enjoy this moment together. I'll be your company from now till it's 4 p.m. Plus, be reminded a repeat of this program comes every Monday from 11 a.m. till it's 12 p.m. And also, halfway into the program, our phone lines will be open for you to call in to be a part of the program. And when it's time, don't forget to kindly turn down the volume of your TV set or you move away from it so we can hear you. And in today's edition of the program, we will be talking about malaria. All right, so you don't have an excuse to say, this one has nothing to do with me. Stay tuned and get informed and adequately educated about how you can protect yourself from coming down with malaria. I have with me in the studio this afternoon Dr. AYUBA NAMANG JEHU. He is a resident doctor with the Department of Anatomic Pathology and Forensic Medicine, Jos University Teaching Hospital. Good afternoon, doctor, and thank you so much for coming on the program.
Thank you. Good to have you. Good to be here again.
All right, it's actually good to have you back on the platform. Okay, so when we talk malaria, is it every mosquito bite that results to malaria, or there is a specific kind of mosquito that carries the disease, the virus, so to say?
Okay. Thank you. Good afternoon, our viewers. I bring you greetings from myself and, of course, the association on behalf of whom I'm here today, the Nigerian Medical Association. Malaria. I know there's so much that has been going out. There's so much information, there's so much misinformation, there's so much misconception, and so much going around. Malaria, typhoid, the typical scenario, if somebody has headaches or fever, he quickly rushes to the chemist and say, I have malaria, please give me malaria drugs. Give me anti-malaria, give me all of that. So the question is, what is this malaria? Okay. I would want to presume that our viewers do not know what malaria is. Okay, and then I'll go ahead and introduce. Then I'll answer your question.
Go ahead.
Okay. Malaria is a disease that is caused by a parasite. Okay. The parasite is called Plasmodium. There are several species of Plasmodium, notable of which is Plasmodium falciparum. That is the most commonest species of malaria-causing agents that we have in Nigeria and, of course, sub-Saharan Africa. Plasmodium species. Other species which are not commonly found here include Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium knowlesi. Okay, now all of these are parasites, okay, that cause the malaria disease. Okay, how do they cause malaria? They cause malaria when they are transmitted to humans. Okay, now who carries them and transmit them to humans? It's mosquitoes. Okay, and then the question, how many is it every mosquito bite that translates to malaria? The answer is no, because we said it is transmitted by parasites, Plasmodium. The Plasmodium is carried by mosquitoes. Okay, so mosquito is a vector. Okay, vector is a living organism that carries a disease. Okay, so now in this case, now mosquito is a vector that carries the agent that causes malaria. Okay, so now if an individual gets bitten by a mosquito, for the person to develop malaria, certain conditions have to be met. One, the malaria has to be actually infected. The mosquito has to be infected by the parasite. Okay. Now, even the mosquitoes, it is not every species of mosquito. Okay. We have what we call the female Anopheles mosquito. Okay, the female Anopheles mosquito is usually the particular type of mosquito that carries, the Plasmodium parasite. So that goes to say that there's a male Anopheles mosquito and it doesn't carry, the parasite.
Okay, so the male are less.
Yeah, the male do not carry the parasite due to some genetic makeup, of the mosquitoes. Okay, now so an individual that would develop malaria following mosquito bite would have been bitten by an infected female Anopheles mosquito. So it is possible for the mosquito not to be female Anopheles. It is possible for the mosquito not to be infected. Okay. So if a mosquito is not infected and it bites the individual, of course we do not see the person developing malaria per se. Okay, so now having understood this, how do you know which mosquito is female Anopheles or which one is not? There's no way you will know. You cannot know it by simple physically looking at the mosquito. So that is why it is advisable that you employ all preventive measures to prevent mosquito bite as a whole. Not to maybe say, okay, I'll wait for only the male Anopheles mosquito to bite me, or the Anopheles mosquito that is not infected. You don't know which is which. So advisably, we protect against all forms of mosquito bites.
Okay. So you hear some people say, it's just mosquito now, it will just bite you and that's all. Is it not malaria? How serious is malaria? And is there statistics of malaria prevalence on the plateau?
Yes. After smallpox, the highest killer of mankind has been malaria. Okay? There was a time in the past when there was a disease known as smallpox, and it killed a lot of people, It was very rapidly spreading, and so a lot of people died. But one killer that is out there that has killed so many people and is still doing so is malaria. So it has killed more people than all the other diseases we have around. Even more than COVID-19, more than HIV and AIDS, more than diabetes, more than tuberculosis, so you can see that it is a very serious burden. Now, unfortunately, there is a population that suffers more, okay, and that is the children under 5 years. Children 5 years and below, and women who are pregnant, okay, they tend to suffer more from the effects of malaria. But then, the common misconception is that malaria is a minor illness. Well, it may be, given that we are living in a malaria endemic region. Endemicity is a term or terminology in epidemiology which means indwelling. Let me just say that. Epidemiology is a study of the distribution and the occurrence of disease. Okay, then under epidemiology we have what we call endemicity. During COVID-19 we say there was a pandemic. Pandemic simply means an epidemic that has affected the whole world. Okay, but endemicity means it affects one part of the world and it is there continuously. Okay, so sub-Saharan Africa and some parts of Asia are referred to as malaria endemic regions. Okay, and that is because malaria is with us almost all through the year. Okay, now, but there are factors that are responsible for that. Okay, one of it is our temperature. Okay, the malaria parasite and the mosquitoes specifically breed in hot climates. Okay, if you go to the US or Russia, for instance, where temperatures could go as extreme as -10, -20. Mosquitoes will not survive that kind of temperature usually, so you are not likely to see them in that part of the world. But of course, in Nigeria, temperatures could go as high as 42, 43, 45. Okay, in that case, of course. And then, of course, other factors, environmental hygiene. How well do we keep our environment? Now, why we are even talking about this topic now is because of the season. Temperature is not the highest now, but there are other factors that contribute significantly to the growth of these parasites. What is that factor? Number one is rain. Okay, rain and moisture. When there is rainfall, there's going to be moisture, there's going to be water bodies, then there's going to be vegetation all over the place. Now, mosquitoes are a kind of funny parasite. They do well in dark environments. Okay, so and then they do well in moist environments where there are water bodies. Okay, where you let's say keep a bowl of water, dirty water supposing, in your compound. When you come around in the night or in the morning and you touch somewhere, you see them living. They like to stay in that kind of place, and usually the kind of temperature or the kind of weather that will provide that kind of opportunity for them is the rainy season. Okay, where we have high rainfall, we have water bodies, damp areas, we have grasses, vegetation growing all over the places, even in our neighborhoods, in our houses. So they grow, they hide under those grasses, under trees. Okay, the dark places, and then they reproduce there. So you can see there's a reason why they are endemic. Okay, then you now go to even the dry season when we are supposed to maybe say we don't have them anymore since it is not raining. But if you check it, you still see that we still have gutters all over the place. Okay, so our drainage systems are not so good. So our dirty waters don't drain appropriately. We have water bodies accumulating. We have we have even trees sometimes growing in those places. Okay, trees and vegetation growing in those places, and then it encourages their growth eventually. So you can see that malaria, so to say, is endemic. It stays and lives with us for certain reasons. Some of the reasons beyond our control, of which I talked about, the climatic. You cannot change the fact that it is rainy season. You cannot change the fact that heat will come, the heat season will come. Okay, but some of the factors are within our control. You can change the fact that there will be no gutters left around, no gutters in your houses, no grasses and bush all over the place. Okay, and then of course part of the problem again is because of the poor education. Okay, our health-seeking behavior is probably not optimal. We see people who are comfortable. Okay, I've seen a scenario where I was quite disgusted that these people were eating. They sat down in front of their house and they were eating, and they sat on the floor. Okay, and they were eating, and then there was gutter right by the side. Okay, the stench from the gutter is so disgusting. Yet somebody could sit there and eat. If someone could sit and eat in such a kind of place, just imagine. It means even if grass is growing in his bedroom, he won't be bothered.
You'll be fine.
Okay, so these are some of the things we do that attributes to the high incidence and endemicity of malaria in these parts of the world.
Okay. So speaking about the rainy season and moisture, it's rainy season now. So we can't run away from having our environment being moist. So how can we now take care of our environment to ensure that malaria parasites are reduced to the barest minimum in our environment?
Okay, I think this is about the most important thing in this discussion. And I would say that if our viewers won't take anything home, it is the fact that malaria is completely a preventable disease. Okay, and how do you prevent? Basically by preventing the bites of mosquitoes. Okay, then how do you do that? By keeping the environment clean. I remember somebody asked me a question a while ago. He said, for those of us that have wells in our house, we must fetch water, Shebi. I said, yes. He said, so how do we do? You know, it's appropriate to cover the wells. Okay? You cover the wells. Any water collection around your house, in or around the house, make a drainage for it, let it flow out. Okay? And of course, not just because of the malaria, even because of flooding. If we don't create appropriate drainages around our houses, eventually if the rains come and they are heavy, our houses are going to be flooded. Okay? And of course, this same water that runs on the ground will now pick harmful. Of course, we know that one of the diseases associated with flooding is even cholera. Okay, because imagine it picks some fecal material from all over the place and then it comes and dumps it. You know, so you can see. Okay, so one, covering the body of water or the source of water very well. Two, creating drainages. Okay, appropriate drainages so that water bodies do not collect. I've been to places, some of us grew up in rural settings, where you see when they wash plates, the wash basin is left there with the water. And if they eat food, they just throw the plate inside the water and accumulate until when it is time to wash again. They wash and then maybe, I don't know what criteria they use to discard the water. And sometimes they allow, even after washing now, they allow the same water and use it another time to wash. Why not throw away the water? Let everywhere be dry. Okay. Then thirdly, clearing the bushes around. Okay. Thankfully now there are insecticides. If one feels too exhausted, maybe from work or something, and you cannot take up your hose and start weeding around the compound, you could just use chemicals, spray the grasses dry up, and then keep the vegetations away from your houses. Not just because of malaria. How about snakes? We talked about snake bites the other day. So when you keep your environment dry, free from grasses and vegetations, you are indirectly keeping this malaria away, because you are keeping the vector that carries the malaria to you away from you. Eventually, if it doesn't come close to you, it will not bite you, and of course you will not develop malaria.
Okay.
Yeah.
All right. So for most diseases, we know there are vaccines for them. Is there a vaccine for malaria?
Okay. I like this question. I like the questions about vaccine. Just this afternoon, I gave a seminar presentation about cancers. And one of the questions that I was asked is, are there vaccines for cancer? And, excitedly, yes. Vaccines are coming up at every, from every angles for different diseases. Okay, I'm aware that there is currently trials ongoing for vaccines against Lassa fever. Then there are vaccines against cancer. You can imagine almighty cancer. Then of course vaccines against malaria. Yes, there are vaccines against malaria, but these vaccines are not readily available. Okay. There are vaccines that have just been approved for use recently, and I'm aware that some African countries are already in purchase of them. Okay, in Nigeria, there have been an attempt by the government to buy at least the first tranche of the malaria vaccine, which was in December, I think 2024, where we have states like Kebbi State and Bayelsa as the primary beneficiaries of those vaccines. Okay. However, it should be noted that these vaccines benefit only children; they do not benefit adults. So, why don't we protect ourselves first? Okay. So while the vaccines are being worked on, while we look forward to the availability of the vaccines to everyone, we also hope that people would still adhere to practices that would, protect them against malaria. And of course, malaria is not as simple an illness as we often, refer to it as. You will not believe it. You will not believe what malaria can do. You see, we have simple malaria where the person just develops headaches, fever, and then he takes some anti-malaria and he's fine. Okay, but we have complicated malaria where you see an individual convulsing. And for every time a person convulses, the brain is being damaged. Okay, and this is more common in children. Okay, then we have cases where malaria can cause severe anemia. Anemia is shortage of blood. So imagine you have severe shortage of blood in the body. Eventually, the person can die. Okay, or imagine the person has acute kidney injury. One of the problems that you see a person passing urine. I've seen a case of malaria. We used to refer to it as medically we refer to it as black water fever. You remember we talked about rice water fever in cholera the other day, where the person passes through that looks like water after you finish washing local rice. You know how that water looks. That is how the kind of stool in cholera looks like. But then in malaria, we have complicated malaria. We have what we call black water fever. The person passes urine that looks like Coca-Cola.
Wow.
You can imagine Coca-Cola, as black as it is.
It's scary.
Okay, what that means is the kidneys have been affected already. Okay, so it's not as easy as one would say that. Okay, I know that because of some certain immunologic improvements, there's a concept of what we call hygiene hypothesis in sciences. In hygiene hypothesis, an individual gets exposed to certain unhealthy amounts of harmful substances. Okay, and then the person develops mechanisms to cope or to fight those agents. Okay, now averagely the average African has developed certain immunologic tolerance against malaria. Okay, and that is why it is being masked. So it now looks as if malaria is such a negligible illness. It isn't. It isn't. Okay, there are people that have died that you look for the cause of death. Eventually, you discover it was malaria. Like, malaria, how come? I happen to have managed a patient a few years back here in Jos, one of the private facilities. This man, he's a Lebanese. Okay, and he was also febrile, vomiting, highly unstable. He was almost in shock. He was going into shock, and eventually we sat down, stabilized him, and started looking around, doing all manner of tests to find out what is the problem with this man. Guess what? It was malaria. How many plus? 1 plus. So you can see, if you think malaria is that simple, it's not necessarily simple. Maybe your body has developed certain immunologic tolerance that it can handle it significantly, but it is not so for anybody or for everybody. Children especially suffer it more. Pregnant women suffer it. Other people who are immunocompromised, people who have diabetes mellitus, people who have HIV, okay, they are immunocompromised, so they may easily fall victim of the malaria parasite, much more than the healthy individual.
Okay, so you spoke about headaches and fever. So should every headache and fever be classified as malaria?
Well, I would say no, but that is what is happening anyways. People develop fever and headaches. I have malaria. I have sat down in the consulting room several times when patients walked in, and I asked them, what can I do for you? And they say, I have malaria and typhoid. and you ask them, what is malaria and typhoid? Say, this is what I'm feeling in my body. I have malaria and typhoid. And you ask them, what exactly do you feel in your body that you think is malaria and typhoid? And they say, headache.
They made their diagnosis.
They've made their diagnosis. But me and you know that if you have not eaten food from morning till now, you're going to have headache. Does that make you to have malaria? No. Okay. Now, headache is not a specific symptom of malaria. Neither is fever, neither is vomiting, neither is any other symptom. Okay. But of course, there are common symptoms. When you put everything together, okay, eventually you take the history of this headache. When did it started? How did it started? How has it been from the time it started? Any improvement? What is going on? How about the fever? When did it start? How is it? And then of course the type of fever in malaria has a characteristic behavior. They call it high grade intermittent fever. High grade means the body will be very hot. Okay, but it is intermittent. The body becomes very hot. After a few hours, it normalizes. Temperature is okay. You would see that such individuals will come typically in the evening and say, Kai, I'm having fever and headache. And they look for food and eat. And then they drink water, they sleep.
Okay.
Then in the morning they go to work. They are very okay. Once it is around 3 p.m., they begin to have the symptoms.
Symptoms, okay.
You know, so you can see it is. Now, the type of fever you see here is different from the type of fever you see in diseases like Lassa fever. But Lassa fever also has fever. Shebi? Fever na fever, but fever day inside fever. Abi? So one is intermittent, it comes and goes. The other one comes and stays with you. Okay?
Okay.
And of course, it's not only headache, it's not only malaria and Lassa fever that causes fever. Many other things.
It could be symptoms of other ailments.
It could be so it is now up to the clinician to put these things together. Okay, this and this and this are positive, or this and this and that are negative. Okay, and then you classify them. Okay, then other symptoms in children especially, apart from fever. Children, if you meet a 6-month-old child, he won't tell you I'm having a headache.
Yeah.
In fact, he won't even tell you I'm having fever. You will feel that the body is hot.
The body is hot.
Then you will notice certain things. Maybe he used to play. Suddenly
No longer playing.
he's not interested in playing. He's just one place, he's sleeping or lying down. He used to eat food. Now he doesn't want food. Even the breastfeeding that they used to breastfeed, he doesn't want the breast milk anymore. You know that something is wrong.
Yeah.
Okay.
Definitely.
And then maybe you notice he's now vomiting, or maybe he's coughing, or maybe he's having he's passing watery stool. He's looking weak. These are all symptoms, okay, of malaria. Then of course in adults, it's not exactly the same. Okay, in adults commonly, apart from the fever and the headache, you will see people talk about joint weakness. Say, Kai, my joints are weak. My joints are paining me. Okay, some of them have back pain. Okay, some have generalized body weakness, unspecific symptoms. Okay, and sorry, I forgot to mention that in children commonly, you also have convulsions.
Okay.
And convulsion in children could happen for two reasons. One, it could happen due to the malaria itself, or it could happen due to the fever. If the fever is very high, it could trigger convulsion.
Okay.
And that means fever from any cause can actually cause convulsion for children.
Okay. Viewer, we take a very quick break. When we return, the program continues. Stay tuned. Welcome back, viewer. The program is Healthcare, coming to you live on the TV arm of Pure TVC right here in our Rayfield studio. And we've been talking about malaria with Dr. AYUBA NAMANG JEHU. He's a resident doctor with the Department of Anatomic Pathology and Forensic Medicine, Just University Teaching Hospital. You can be a part of the program this afternoon by calling the number 080 34 475287. I'll take the number again, 080 34 475287. Please, when you get through to us in the studio, don't forget to turn down the volume of your TV set, or you move away from it so we can hear you. The phone line is free. Please ensure you call in and be a part of the program this afternoon. Right, so before we wait for calls, you spoke about pregnant women and children being prone to malaria. So what are the do's and don'ts for a pregnant woman from day one?
Okay. I would first of all explain why pregnant women and children are more at risk. For children, the immune system has not undergone full maturation.
Okay.
Okay, from the time the child is born, there are certain parts of the immune system that the child is born with. Okay, that naturally by nature, these parts of the immune system are there. You know, they are working already to protect the child from whatever it is. Then there are also parts of the immune system of a child that needs to mature, and they mature over time. And then this maturation follows this same hygiene hypothesis that we said earlier, that when you get exposed to something, your body begins to form certain defense mechanism against that thing, so that you overcome that thing. Even if you are exposed to it subsequently, your body will be able to fight it. Okay, and that requires time. So that is a part of the immune defense mechanism that children do not have. And as a result, the malaria parasite, when it takes advantage of the window period, it enters the body and it causes havoc to them. Now, again, one of the reasons why they suffer it is because, now, do you know that about 65% of the human body is water? Okay. Now, in children, it is even more, up to 70% or more. Why? Because the solid tissue in their body has not yet matured. Okay. Likewise, even some of them, even the so-called bones that we talk about, some of their bones are still cartilages. Okay. As at birth, most bones in the child's body are cartilages. They've not formed to become bones, real bones. Okay. And the water content of cartilage is far more than that of the mature bone. Okay, so their body is largely water. And then when children have malaria, they vomit. That's the first thing they do. They have fever, they vomit. When they lose water. The reason why the human body is composed majorly of water is because you need the water, okay, for your survival. The sum total of the solid tissue in your body is not up to the water. Okay, so that is why children, when they lose water, they are losing a large chunk of their body, because more of their body is more of water than it is solid tissue. Now, pregnant women, by reason of pregnancy, okay, one of the hormones that is secreted that maintains pregnancy, okay, is a steroid. Okay, and steroids are hormones or substances in the body that they have an anti-inflammatory effect. They have anti-inflammatory effect, and then they have immunosuppressive property. Let me break down the word. Immuno means immune system. Suppressive means suppression. So what it means is they have a tendency to suppress the immune system. I don't know if it's clear enough. Okay, so the hormones that are produced by pregnancy that are going to be used to maintain the pregnancy in the womb have a tendency to suppress the immune system. So they would suppress the immune system of the woman. So a woman who previously had developed immunity, okay, when she was a child, she grew up, she developed immunity to the malaria, and then now her immune cells are fighting. Suddenly, she gets pregnant, and then the hormones in pregnancy now suppress this immunity. Malaria here, celebrates. Here I come, so it enters the body, and then it begins to cause damage. And remember that we're not looking at only the woman if a woman is pregnant, because the malaria can actually affect even the child. And remember earlier that we said that one of the complications of severe malaria is severe anemia, where there is severe blood shortage. Okay, so if the woman does not have enough blood already by reason of pregnancy, the blood level of a woman drops. Then imagine she now has malaria, further reducing the amount of blood in the body. She goes into anemia, and now chances are that she may even miscarry the pregnancy. Okay, chances are that the child in the womb may not grow normally, because even the nutrients he takes to grow in the womb is coming through blood. But we're saying there's shortage of blood in the body. So what it means is he won't have enough of the nutrient that he's supposed to have. So you can see if a woman is pregnant and she's having malaria, two people are suffering. Okay, now and that is why it is critical. For women who are pregnant, there is what we call intermittent preventive therapy. There are drugs that the moment you go for antenatal care, they will start telling you, make sure you sleep on that net too. They will start telling you, make sure you do this. They will educate you. It is not because they want to do it, but because there are relevance to whatever they are saying. Okay, they will educate the woman. They will tell her to use it. And that is why when government initiate all these roll back malaria programs, you discover that the target is usually women. You know, the other time one of my brothers went where they were distributing it. They sent him away. They said they cannot give him the net. He went back and then his wife came and they gave her. Why? Because the women are more vulnerable. Okay, and when you protect them, you protect the whole family. And moreover, if the woman gets the mosquito net and she brings it home, the husband should.
That's the point where they will say, "Waiting man do man."
You understand? So you can see these are the reasons why these two populations are a very vulnerable group. Okay, so it is usually so much emphasis on these two, population, and of course the elderly people. But of course, the elderly people really suffer from malaria because their immune system has already adapted significantly. Although by reason of aging, the immune system would have been weakened significantly. But again, by reason of acquisition of defense against the malaria parasite, over time of exposure, since they were children till the time they grow old, they are still able to retain immunity against the malaria. So it still doesn't have effect on them, despite the fact that they have somewhat suppression of the immune system.
Okay. Viewer, if you just tuned in, the program is Healthcare, and you can be a part of the program by calling the number 080-3447-5287. If you have any questions, you have any concerns, or you need clarity, please do well to call in. And the doctor in the house will be delighted to respond to whatever questions you have. So please keep those calls coming in. We'd love to hear from you. Right, so we know there are some mosquito nets that are not treated. Are they also safe to use?
What do you mean by safe?
Will it protect one from mosquito bites?
Why not? Unless the fenestrations in the mosquito net are so big that the mosquito can pass through. The mosquito nets worked by dual mechanisms.
Okay.
Two mechanisms. One, the chemical agents, in such a way that once the mosquito touches the net, the chemical is toxic to the mosquito itself.
Okay.
Then secondly, the barrier is a barrier now. Okay, supposing the chemical wears off over time, the mosquito can still not enter inside the net because it is a barrier. Okay, it comes and then it cannot squeeze itself into the net eventually. So whether or not the mosquito net is treated, it can still serve some function. But then it's advisable that people get the insecticide treated mosquito nets.
Okay.
Yes.
All right. So you made mention of quite a number of symptoms that is associated with children plus malaria. So are there early signs or symptoms that parents often miss or pay less attention to?
In malaria?
Yes.
Well, I wouldn't necessarily say so. Now, this is the reason. You know, the nature has endowed the immune system with so much ability to do a lot of things. Okay, or it has endowed the human body with so much ability to do a lot of things. And that is why the moment the parasite enters the body begins to look for means. When you see somebody having fever in a sense is not actually the parasite showing itself. Fever is the body fighting. Okay, for medical people, they will tell you that fever is the immune responses, is the immune system's response to a foreign and invading So the moment you begin to have fever, it means that moment, that is when the body recognizes that, see, there's somebody that is not supposed to be here. It's more like in PRTV here, you have security men. Okay? The moment you hear the security man blowing whistle in the night,
something is wrong.
there's a breach of security. Somebody somewhere, somebody has entered this place that should not enter. And that is what fever does. Okay? It simply means the body is mobilizing. Okay, so the earliest symptom usually is fever. And I don't think parents would easily miss fever. Funny enough, somebody told me, one of my trainers then would say that he likes pediatrics medicine, that's the medicine of children, because of one reason. He said children, if they are sick, they are sick. From the moment they are sick, they are sick. And you would see it. They won't even have to lie about it. They won't even have to cover their symptoms. And then, no, it manifests from the very beginning, from the very time that the illness starts. Just that sometimes, maybe we don't give them much attention. Sometimes we just give them PCM at home. Bona Babe and the rest of them. Some parents have known all the pediatrics medications. They will buy them and stock them. And when the child starts running temperature, come, they will fetch, but it's not supposed to be. In fact, you would find out that pediatricians hate using paracetamol for children. They would really have problem with it because it doesn't really give a true reflection of what is going on. Okay? That's why if you go, they will tell you they will prefer to use a towel in water and be massaging the baby's body until the temperature comes down, than giving drugs to crash down the temperature. Okay, so usually the earliest symptom you will see is fever. And fever does not hide itself. If it is there, it is there. You will find out.
Okay. So you hear some people say, I treated malaria a while ago, so I don't need to sleep inside mosquito nets because it is said that you come down with malaria just once. And others,
once in a lifetime.
Yes. And others would say, when you have malaria, just get bitter leaf, wash it and drink the water. You'll be fine.
Well, we have been trained to never say never and to never say always. If I tell you today that bitter leaf is not medicinal against malaria, I may be lying. It is possible that there is, but it has not yet been discovered. It is possible it is just being discovered now. It is possible it was never discovered before and it will not be discovered. Okay, but I will tell you that to the best of my knowledge, I'm not aware that bitter leaf cures malaria. Okay, so usually, yeah.
Okay.
Just not cure malaria. not to the best of my knowledge, honestly.
All right. Yeah. Okay. So beyond this advocacy, plus the hospitals, what role should schools, churches, and mosques play in malaria sensitization? Because this is everybody's business.
Before I say that, I want to talk about something. I need to address this particular thing. Now, recently, research has shown that there's what we call resistance.
Okay.
Antimicrobial resistance. And what that means is the microbial organisms do not respond to treatment. Using the same agents that they used to respond to before now. Okay? What that means is you may give an anti-malaria today, the same anti-malaria you have used 5-10 years back, and you got very good result. Now you are using it and you don't see results, and the parasite is there looking at you. Okay? Now, it has been reported in Asia and Africa. Okay? And of course, these are the two continents with the highest burden of malaria. And now, unfortunately, why? Because we abuse drugs. Drug abuse does not necessarily mean you buy cocaine and take. When you don't take drugs based on prescription, it is drug abuse. If you have malaria, supposing, and then you have a drug given against the malaria, and then you start treating, you take the first dose, you take the second dose, and you feel better, and you abandon the drugs, that constitutes drug abuse. Okay? So by the time you do that, Supposing the parasite in the body was dying and it is halfway gone, now you've discontinued treatment, and then for some reason it survives. Now, in the process of surviving and recovering, it may acquire some mutation, some change in its gene. Okay? That will bring about what we call a resistance. So the malaria now, the mosquito now, the malaria parasite now, if you use the same drugs you used that time, it will not respond to it. More like, not be this thing you used for me that time where I survived. I will shift. Then you don't mind me, please. Then you be like, what is going on? So imagine you keep going through using different drugs like that. Time will come when even most of the drugs that are available will no longer be active. Okay? Now, some years back, when we were children, it used to be chloroquine they used to use for us, Abi. Before chloroquine, we were told before our own time, they used to use quinine, almighty quinine. That is the most biggest drug in the treatment of malaria. And of course, the most undesirable drug, because the side effects of it, if you take one, you may be useful for the rest of the day, useless for the rest of the day. Okay? Because of the side effects. So you can see that resistance is a very big. I'm talking about this because we need to be careful. Okay? Unfortunately, this resistance, if I abuse drugs now and the parasite in my body becomes resistant, and another mosquito bites me and picks this parasite and bites another person and infects the person, the new person acquires the resistant one because it has been mutated already. So even him that previously would have been using drugs that would be active, if he uses now, it won't be functional again, even if he uses the drugs correctly, because there's already a resistance. So you can see how very important it is. Sorry, I digressed a little.
Okay, so you have some people say my body reacts when I sleep under mosquito nets. So it's preferable I use insecticides to spray the room and just allow it for a while. So which would you advise that people go for? Which is more effective?
I would advise that you go for what is available and what is tolerable. It is true that some people react to when their bodies come in contact with the nets. But in the net, there is a specification that says you should wash the nets before you start use. You wash it and dry it.
Okay, you have to wash before drying, not just drying.
No.
Okay.
You wash and then you dry, you air dry in, in a shade, not under the sun. Okay. Now some people would go and dry under the sun directly. Some will not even dry, they just remove it from the leather and just put it on their bed. And then, of course now, but of course there are some that when even after following the instructions, they still develop some reactions. Then you be careful. Okay, there are several ways to go about it. Not every net is insecticide treated, and some would wear out eventually. Okay, so you could go for maybe the ones that are not insecticide treated, and then you could go for insecticides. Again, these insecticides, whether something has happened to them also. I noticed recently, even in my own place, you apply, you see them working about. They seem to have outgrown the effect of whatever it is you are using. So probably they have resistance as well. So, yeah.
All right. So what's your parting shot as we wrap up the program today?
My parting words are the same parting words I've always had. That as at the moment, Nigeria is not healthy. As much as it depends on you, try and stay healthy. Try and prevent malaria for yourself, for myself, for everybody around. Thank you.
All right. Dr. AYUBA NAMANG JEHU, Resident Doctor, Department of Anatomic Pathology and Forensic Medicine, thank you so much for coming on Healthcare and educating us. It was quite an insightful moment with you on the program. Thank you so much once again for your time.
Thank you.
Right, viewer, this is the much we can take on today's edition of the program. We'll be back on your TV screen next week, same time, same station, God willing. On behalf of the entire production team, my name is Plangret Dabang. Don't forget, Keep your environment clean.